Hello and welcome. This lesson is about the high-frequency scenario called the extension request. I will teach you when and why this happens. Also, break down all the steps you will need to ensure success. Success being authorization for additional skilled visits. This story starts with Mrs. Smith, a home health patient whose initial plan of care is coming to an end. My patient, Mrs. Smith, recently suffered a stroke. Before this, she was living alone, working full-time, living independently, and living an active lifestyle. She was recently discharged from an acute care hospital 3.5 weeks ago. My initial plan of care with Mrs. Smith was 3-week 3 for a total of 9 visits. Today, she just finished completing her 8th visit. Based on today's visit, she's not where she needs to be. She's still not safe in her home, she still needs assistance with ADLs like transferring and walking, and she definitely cannot enter and exit her home safely. The next visit will be the 9th one, which is supposed to be her discharge. However, she's not yet ready to be discharged. That said, I will need to process an extension request. So instead of discharging Mrs. Smith on the 9th visit, she will receive a reassessment visit. This will initiate the extension. So after completing the reassessment visit on Mrs. Smith, my thoughts are confirmed. She remains unsafe in her home and at high fall risk. Also, she is not at her prior level of function, continues to present with impairments and functional limitations, as well as unmet functional goals. Additional skilled physical therapy does remain reasonable and necessary, and she would continue to benefit from further skilled home physical therapy. Based on my clinical judgment, I'm going to request 6 more skilled PT visits for a frequency of 3-week 2. 3 visits per week for 2 weeks. This will total 15 skilled home PT visits for Mrs. Smith. Let's get to work to help Mrs. Smith get those additional skilled PT visits. I'll show you all the steps you need to take to process the extension request. You won't do it alone. The extension request is a team effort. Step 1. You must create a reassessment clinical note, including what goals have been met, any new goals that will be added, and address the patient's current impairments and functional deficits. Also, in the reassessment note, you must document the patient's PT prognosis, plan interventions, and a detailed description on why, based on your clinical judgment, the patient needs additional skilled care. Step 2. Get on the phone and call the referring physician to obtain a written prescription or order to continue skilled home physical therapy. They have to agree with your new plan of care for the extension request to be successful. Strive to speak with the physician when you call. If you do not, you have to leave a message, give the clinical report, and make the extension request, articulating why further care is needed, what your interventions will be, and what the new plan of care will be, and all of the essential information needed so the physician can make a judgment on if he or she agrees with the extension request. Before you hang up, if you're leaving a message, leave your name, phone number for a callback, and have them fax the prescription to the home health agency's office. If you don't hear within 24 hours, repeat this step. Step 3. In the patient's medical record, you must write a therapy order, which must include the details of the call to the referring physician. In the therapy order, you must include the new frequency and duration that you are requesting and the interventions that you plan to perform, and address the patient's continued impairments, functional limitations, and unmet functional goals. Step 4. Inform the RN case manager if he or she is still in on the case, as well as your clinical manager and anyone part of the interdisciplinary team who also is going to be continuing. Let them know that you're planning to continue to work with your patient. Step 5. And the final step, inform your patient that you are waiting for authorization to continue. Importantly, the extension request is not only dependent on the referring physician agreeing and writing an additional prescription, but also it's up to the insurance payer, like Medicare, to give you the approval to continue with your skilled care. Mission complete. You now understand when and why an extension request happens. Also, you have all the steps needed to process one successfully. Thank you so much for listening. Take care.